Sure, we are very excited about this. We have some really world-class collaborators, and we submitted a grant application last year for a new formulation to treat cervical cancer. And this particular disease is really bad in countries where women can't afford all the preventative care that we have here. And so we're really excited because this formulation will allow women to essentially treat themselves for this deadly disease. So we made the grant submission, we got a really good score, and we're hoping that it will be funded soon and we'll start that.
So it's not official, is it officially approved right now?
Well, the way these funding agencies do it, you get a score and you get a fundable range. So we're definitely in the fundable range, and then Congress has to appropriate the money, and then we'll know in the next probably month where we will actually be getting it. But it's a pretty good pretty good chance that we'll get it. And I think the funding date is March 1. So we're preparing already to do that.
So what else can you tell me about how that will work? Is it a vaccine? Like, are you working on something already? Can you tell me about the process?
Yes, sure. The mechanism of action is basically the same. We're putting a flag on the tumor cells so that the immune system can recognize them and destroy them. But we need different ways of actually getting this into the tumor cells. So for skin cancers, it's really easy to do an injection, some of the other cancers, but we can always form different delivery methods that will make it easier. And this particular population of women that don't have access to very fancy laboratories and clinical sites and have just the barest minimum, this is sort of really exciting for us. We're developing these because we want our product to be useful for people that wouldn't have access to anything else. So we're out on the edge here. This formulation we hope to put in a applicator that the women can use to treat themselves. I mean, that's the ultimate goal. So there won't have to be a medical clinic, people traveling miles and miles when they can't even afford to do that. So we're really excited about this study and this product and the grant.
That's really interesting. So were you really focusing on maybe other countries, like you mentioned, that women don't have access? Is this something that you would roll out here in Florida as well, like underprivileged women here in the area? Sure,
yes, in low resource settings in the U.S. So if we're successful in making this formulation where it's stable and it still maintains its efficacy, we will test this in trials here in the state, hopefully here in Tampa. And we'll also set up trials in South Africa and maybe the Caribbean, because those are our two really hot spots. Equatorial Africa is especially hit hard by cervical cancer. The thing people have to understand about cervical cancer is it's viral driven. So HPV is the virus, and most of the time in this country you can take a preventative vaccine that will prevent you from having the virus, but in those countries even that's not affordable. So these women actually go on to develop precancerous lesions and then full-blown cervical cancer. And those are the cases that we want to really address. One of the big initiatives across the world is to eradicate cervical cancer. So the preventative part, is being addressed, but what we want to do is to address the other end to help these women that really have no other alternatives.